At Parkwest, and over the last year and a half, our complex PCI program has added Impella, and we've been able to do more complex procedures with the addition of that.
As the high-risk PCI coordinator, I think the most important part of this role is communication, and that prevents anything getting lost in the mix. Dr. Rahman sort of identified that there was a need for these patients to be seen and taken care of.
A lot of these patients have multi-organ dysfunction that make them high risk for traditional surgery. And so I think that if in that sort of patient, you have to have somebody that is coordinating the care of the total patient.
We have a lot more interaction with anywhere from renal specialists, electrophysiologists. The surgeons are now starting to use the Impella more, getting all of those physicians together and talking about one device.
So these patients come to us from referring physicians outside in our community or even within our practice. If it's a new patient, I call the patient and set up the appointment. The patient comes into the office to see Dr. Rahman, to meet him, so they can actually discuss what his plan is preemptively and leave feeling confident in the care he's going to provide.
These patients have suffered for a long time, and it's nice to be able to finally allow them to get through a procedure that helps them to be able to function as a normal person would.
I think in the past we thought about getting safely through a procedure, and now we see that with Impella we have meaningful outcomes even out to 90 days, and that truly kind of fits the model of protecting the myocardium, protecting organs in order to have a meaningful benefit, not just for the index procedure, but also long term.
We need to be sure along the way and make sure that every piece falls into place so that they can get to the finish line.
It's great to be able to see a patient walk out of the hospital that barely could manage to get in.
That makes the difference between just surviving and the patient actually thriving.